We are not doing full operationalization, but we have started with the opening of the outpatient department that begins operationalization immediately. And that is also important for this country as far as economic development is concerned, continues to happen and is not threatened by disease. And that is why we are keen to ensure that every single Kenyan gets the message clearly, but more importantly, that they meet the government halfway. The government has already put in a lot of money to ensure that primary health care is sorted. We have put in more than 25 billion Kenya shillings to ensure that primary health care services, that is level 2 and level 3, are free. And His Excellency the President has kept saying, walk in, walk out. At level 4, like this one, we then start to encourage citizens to pay for their social health insurance fund. And the government is keen to ensure that we even meet people halfway, that even the things that are very expensive, dialysis, which we are going to open here, we have a huge dialysis center inside this hospital, ICU, cancer, those ones, again, we are paying for them. We have put in more than 8 billion to ensure that we are paying for all cancer treatments, and I think you have known this before. We are paying for ICU services at 28,000 per day. We are paying for all dialysis services at 1.2 million per year, which is 10,600 per session. So we are doing everything to ensure that we solve all the problems that either get Kenyans poor when they get sick, or the things that make Kenyans die when they shouldn't die unnecessarily, including maternity. And so this is an important day for us when we come here and we see serious hospitals like this one, that have been built to standard, that are state of the art. We want to extract that value, and extracting that value means service delivery. And therefore, this operationalization, as much as it is a directive of His Excellency the President, it's also something that we take pride in fulfilling.
Environment of our officers, improve service delivery, motivate staff, and strengthen the public image of our institutions. We also recognize the importance of partnerships in achieving these goals. Going forward, the service will continue to strengthen collaboration with the key stakeholders, development partners, and other government institutions to ensure that our people not only gain access to better health care services, but also specialized services. We want to encourage all of us to register with the SHA so that this is a government policy, and this is something that our chief guests want to confirm, that even the inmates already, we are registering them with SHA.
And I want to thank the entire team for the operationalization team for the good work and the RRI effort that they have made to make this happen, so that we comply with the presidential directives. I believe we are all aware that universal healthcare is one of the pillars of the bottom-up economic transformation agenda. Already we are registering all our inmates to SHA, and all our officers are migrating to use fully of SHA effective 1st of April, and therefore it is timely that this hospital be available to all our staff and our inmates, as well as the community. Today we shall begin outpatient services, and we are ready to move forward with this. We also appreciate the strong multi-agency collaborative framework between the State Department of Correctional Services and the State Department for Medical Services. Plans are underway, and they're actually ongoing, to formalize an MOU with the Kiambu County government to facilitate deployment and support of specialist medical personnel to the facilities, as well as discussions are also ongoing with Kenyatta University Teaching and Referral and Research Hospital with regard to interim utilization of their morgue facilities pending completion of our own hospital mortuary. So we affirm that the State Department is fully committed to ensuring that the hospital operates efficiently and contributes to quality healthcare for officers, inmates, and surrounding communities at the highest level of standard.
This is the model for the hospital. So the hospital is made with the KDF model, quite a number in the country. It has 3 blocks. Where we entered with here, male and female. The female ones are on the 2nd floor, the male ones are on the 1st floor. So
on the level of the ambulance. So the ambulances that come with this, they can as well be at the level of the stretchers. Yes, young man.
Welcome, madam. I'm Timothy Shepard. I'm a nurse by profession. Here we do triage, we take the vital signs. From here, I schedule you to one of the medical, one of the MOs.
Oh, I'm good. I'm breathing properly. I'm breathing properly.
Madam is to have a seat.
No, I'm bringing you for blood pressure.
Yeah, we'll come for blood pressure. We could, in fact, sorry, May.
Okay, great.
Anything above 95 is very good.
It's very good. Okay.
Yeah.
Good. That's 60 samples of the
60 samples and your work. And on one side, what takes 1 hour.
So we have this one.
And it does.
This is even to come even earlier than
But this is good enough.
Yeah, but this is to start off.
The other specialized, it can do a lot of things. This one can do that.
Yes, needs to see the quality.
And this is the one.
Or is the other not?
Four. No, you don't think they should use it right now. And there's a team that is working on this.
That's oxygen.
That's what it is. From our side. So, madam,
For monitors, 2 ventilators, 2 SGU beds, and 3 emergency trays.
You still need a lot of equipment.
yes. So I think again the next will come with the next
Will come
with the next team.
So we still have quite a bit of work. So
Yes.
but today the outpatient.
Outpatient will be able to be a
But then the inpatient, what are we? When?
I talked to Penny, we have some partners who can be able to support us. So the second
Second, how are we in 2 weeks?
no, maybe 2 weeks.
Standard is
very
very good for air circulation.
The
The lighting is good.
window.
remembrance of this day, we have a few chairs because we are predominantly guard. Very much our guest, makofi kidogo. Thank you for your good work, and then the certificate then proceeds to the Commissioner General, with that kind gesture of approving this institution to go forward. At this time, allow me briefly to thank you for presenting.